Today we're getting under the hood of women's health with Dr. Andrea Braden, a dynamic CEO and founder of Lybbie, a revolutionary startup dedicated to empowering breastfeeding individuals. With her background as an award-winning board-certified OBGYN and board-certified lactation consultant, Dr. Braden brings a wealth of knowledge and passion to her mission of improving maternal health and wellness. Dr. Braden will get under the hood of breastfeeding and breast health.
Hey, everybody. Great to be here. Thanks for having me, Elizabeth. My name is Dr. Andrea Braden. I am based out of Atlanta, Georgia, so down in the Southeast, and I am trained as an OBGYN. But back in 2015, I got extra training as an IBCLC, which is a board certified lactation consultant. And all of these things together make me a breastfeeding medicine specialist. So I worked in academia for a long time, teaching the world's future doctors and the doctors of America how to support breastfeeding and chest feeding and lactating individuals. And last year, I took a leap of faith and left academia to pursue my own startup company, Lybbie, full time. So I also serve as the CEO and founder of a lactation startup company. I always say that my passion and my need to advocate for lactating people began in a very personal place. In 2009, 15 years ago, I had my first baby. I was a third year OBGYN resident, and I was very flippant about feeding my baby. I was very confident, and I said, whatever, fed is best. I don't care. I'm going to rock this. And what I didn't expect was how important breastfeeding would be to me personally. And especially, I didn't expect to feel so ashamed of my lack of knowledge as a women's healthcare provider when it came to breastfeeding on my own. And then I thought of all the bad advice I gave people before I had my own baby. And I realized there was a real lack of knowledge there in my own training, in my specialty of choice. But the real fire came from, in 2010, Annalise was 10 months old, and I was getting a lot of criticism in the workplace about maybe needing to see a lactation consultant because, I pumped too much, and this coming from people who had never breastfed and a lot of criticism. And I think I knew in my gut that I was in the right, no matter what people told me. And I literally walked out on my job. I almost quit medicine before I ever got my career started because I knew deep down in my soul, as much as I always wanted to be a doctor, that before that, I always wanted to be a mother. And this was so important to me that it felt like there was no question that I would choose my baby over my job. Now, fortunately, I did not quit. And I had some great mentors who diagnosed me with postpartum depression, all related to my breastfeeding experiences. And once I emerged from that cloud, and I got my life back, I came on to work in academia at the University of Connecticut, and I had to teach something. And they're like, you got to teach something. You're in academics. You can't just fiddle around. And I was like, I don't know what to teach. And they said, breastfeeding. And I was like, oh my gosh, I am obsessed with my baby. Like I could talk about breastfeeding all day long. So I became, this was before breastfeeding medicine was even a specialty. I was looking for my people and looking for resources to educate my med students and residents. Like, how do I integrate this? I realized there was a need in OBGYN. How do I do this? And I stumbled upon an organization called the Academy of Breastfeeding Medicine. And I jumped on an airplane and went to this conference by myself, not knowing anybody, and met some of the most amazing mentors who are still my mentors today, who took me under their wing. For the first time in my life, I saw OBGYNs, doctors like me who cared about breastfeeding. I had never met anybody like me before. And it felt like coming home. And I also met the first physician that I had ever seen who had an IBCLC. And I thought that was the coolest thing ever. And I was like, I want that. I want to legitimize this. So in 2015, I sought to get my IBCLC, and that was when I was really recognized, I think, because it's unusual in a medical specialty, in a physician specialty, to have your IBCLC. It kind of put me in this other category, a breastfeeding medicine specialist. And over time, I really developed this niche knowledge about supporting LGBT families and their desire to use human milk to feed their babies, no matter what their family arrangements were like. And so it has been a labor of love for many years, but that's really how it started. It's hard. I think one of the barriers to preparing for breastfeeding or chest feeding before you have the baby is there's a lot of negativity out there. And there are so many people who say exactly what I said. It's hard. You better get ready, buckle up. It's going to be difficult. But it doesn't have to be that hard. There are great resources out there. And one of the primary pieces of advice that I give people before they have the baby is educate yourself as much as you can. It's not as cool these days to go to classes, in person, God forbid, post COVID, but there are plenty of online resources that are trusted. There are tons of YouTube videos. And I think really, first and foremost, figuring out how to create a healthy milk supply can get you through so many hurdles. And what I mean by that is, I think of it like the gender pay gap. I don't know if you've talked about this on your program, but I have been subject to the gender pay gap as, a cisgender woman. And the way that philosophy works is, women traditionally will start off at a lower salary. Men start out at a higher one. And over time, even though both go up, the men's goes up at a much faster rate. And so the women are never able to catch up. And to me, it's the exact same thing as people who start off on the right foot with making milk and people who run into barriers early on and never get that baseline supply up. They are never able to reach the milestones that somebody who has a robust supply at the beginning. Why is that? And I'll caveat this to say there are many reasons to have difficulties in developing that initial early milk supply. But the reason why it's so difficult to have this long-term breastfeeding journey, if you're not set up the right way from the beginning, is that having a healthy milk supply where you don't have to worry about how much milk your baby's getting, and maybe it's a little bit above where it needs to be, is helpful when you run into other issues. There are always other challenges. So say your baby is ill or has a tongue tie or hasn't figured out the latch, or, maybe you're sick. These things can cause dips in your overall supply, but they come back. But having, an edge on, and you're not like me, I was paycheck to paycheck. I like to say with my first baby, I just like, I don't know what I'm going to do if I run out of 1 ounce, like I can't go without 1 extra ounce. And I was always living in fear of missing some signal or 1 ounce of my milk. If you have a little bit more than 1 ounce of cushion, you can get through these tiny dips, which happen all the time because of sleep changes and growth spurts. And, all these things are normal. The milk supply is dynamic, goes up and down, depending on many physical and mental health factors for the person making the milk. But you can protect yourself on the front end by learning how to create a healthy and robust milk supply so that you can maintain it for the long-term journey. And then as far as early breastfeeding versus later breastfeeding, early really is more about frequency of the signal. It's supply and demand. So your body is reading signals from your infant or from a pump or whatever you're using to get the milk out. But every time there is suckling on your nipples, it tells your brain, oh, I need to make more milk. And what happens commonly is that for whatever reason, maybe you are completely sleep deprived and depressed and just need a really long nap. So you're going to miss a feed. That is okay. That is good. You should rest. However, if you miss a feed and you give formula or something or donor milk, your body does not get the signal to make that milk. And it adapts very quickly to this lack of signaling, but you can protect against that. And what I think a common misconception is that it needs to be like every 3 hours around the clock, 8 times a day and, very rigid, when actually we're all human. And I think if you think of yourself as an adult person, I don't always eat breakfast at 8 a.m. Sometimes I'm not hungry. Sometimes I eat at 9. And sometimes I'm hungry immediately after eating a bowl of oatmeal and I eat again at 11. Babies are the same way. They're not rigid. It's really the total caloric content over the course of a day. So if you're napping because you need that rest to be able to make milk, to be able to feel healthy, that is okay. And I support you. And we got to make up for that lost signal to your body. The baby is fine. Baby's getting food, however, baby's getting food. If you want to maintain your milk supply, add in a pumping session. Like if you feed 6 to 8 times a day and you took a long nap, so you missed one of those, when you're awake, add another one. After baby goes to sleep, do an extra feed or an extra pump. And then your body's still getting the same signal. And then you're not at risk for losing that long-term milk supply. And that is really one of the most common barriers to long-term breastfeeding and to, keeping your supply up. Once you reach a certain point, which is you get past the point where it's frequency and emptying. Like those are the two key pieces early breastfeeding. You got to do it frequently enough and you have to get the milk out, which, as you can imagine, if your pump doesn't fit right, if the baby has latching issues, you can make all the milk you want. If it ain't coming out, your body is going to get negative feedback and say, well, we don't need it. You're not taking it all out. I don't need to make this anymore. So it really is a two-part process, and your body requires the frequency and the emptying to make an adequate milk supply. But you do get to a point where you're coasting, right? And once you're coasting, it's less about that frequency. It's more about the maintenance. Make sure you get it all out as much as you need every time so that your body reads that signal. It's like, okay, they're still using 3 ounces each time. So I'm going to keep making 3 ounces, every day at this time of day. And so it is very technical. I don't think it's that difficult. It's a lack of information and confidence. And one last thing I'll say, because I read this great book last week and it had an amazing quote. She said that confidence is knowing what is true. And that really resonated with me. This was Emily Nagoski, who writes Come As You Are and Come Together. Great author, PhD, totally unrelated to breastfeeding, although I think everything's related to breastfeeding. But that really resonated with me. I'm like, that is what is breastfeeding confidence. It is so hard to be confident when you don't know what's true. And we struggle all the time because the ways we're supposed to make ourselves feel confident is like, oh, if you pump enough milk, if your baby's making wet diapers, if your baby's weight is growing, why are you worried? And, I think it really ignores the food insecurity feeling that many parents who are trying to exclusively breastfeed have. But how do you know? How do you know? And that's probably a topic for another day. But, that is a major pain point, I think, in breastfeeding confidence and the ability to do this for the long term. So two different issues. So latching properly usually is something we figure out within like the first few weeks of baby being born. And there are some signs that you can look for. I'd say the first thing is setting yourself up for success. And one of the most common things is it's hard to position a baby in an ergonomic way. But if your baby is like, doing that, like arching their back and their chin is up, it's going to be really hard for them to comfortably eat, and just think about it. If it was you and you're trying to drink from a straw with your neck all the way back, it's hard to extract the drink, appropriately. So it's hard to actually get their mouth on the nipple areolar complex, in a way that really effectively pulls the milk out. So nipple areolar complex and latch, what in the world does that mean? So a basic latch is the way that the infant's mouth latches onto the person's breast or chest tissue that is making the milk. And if you watch, if you're like me and you watch people milk cows on TV, a lot of people think that you just do this on the nipples and, bada bing, bada boom, you got milk. Not true for humans. I'm not even sure that's true for cows, actually. But, when you need to extract milk, I think we probably all know that if you just yank on your nipple, ain't nothing coming out of that thing. That really hurts too. Um, the baby's mouth actually requires, almost like a yawn type, latch. So what you're looking for with this newborn with a brand new mouth is they're going to try opening their mouth and they're going to do these little baby openings, but then you look for a big wide mouth. And then as they're opening really wide, you have to have that baby real close because you've got to make contact. It's like landing a rocket ship. You gotta have it at the right angle. So that's where the ergonomics come in. Pillow support for your elbows so that the baby is not dangling off, or depending on the position, lots of different positions to make it easy for the baby. So they only have to focus on wide open mouth. And then you get that wide open mouth and you want that mouth to go all the way around the nipple and past it. So the areola is the wider ring of pigmented tissue behind the nipple. It's different. It's typically a darker color than the rest of your skin. And it doesn't have to be the whole thing, but it needs to latch past the nipple. So if you think of a baby bottle, it's not just the nipple. They really need to latch onto that flatter surface. So the same is true for breastfeeding or chest feeding. Wide mouth, latch all the way on so that you're not seeing just the edge of your nipple in there. And you will know because that really hurts. And it can cause abrasions if they're only suckling just on the nipple. And then if they're on there and they have a big wide suck, you can hear gulping. So the gulping is a sign that the milk is coming out and going into the baby. Another indirect sign would be there are dirty diapers. They almost, a lot of times, early days, they happen instantly while you're feeding the baby. It's shooting straight through them. And then, the other thing is like looking at their cheeks. You want to make sure that they're not like sucking in at any point. The baby should look comfortable and they should have kind of flanged lips, like a little fish mouth, So sometimes they get confused and they like get a lip in there. So you can like just take your finger and pull the lip out. So it's a nice fish mouth flange on the nipple areolar complex. Baby's kind of aligned. You want the baby stomach to stomach with you, which can be, some people want to like tilt the baby out like you're cradling a baby, but it really needs to be kind of facing you. And then you want the head like directly right at that level, however you position the baby. And that all of those magical things together can make for a really good, effective latch. We do know, and it's widely accepted in all the research and data globally, that human milk is the milk that was customized for babies' health, right? It is biologically superior and it's the biologic norm. And that has a lot to do with like immunologic factors. And now we have a lot of data about the microbiome. Like milk has its own microbiome, and it actually populates the baby's gut to protect the baby. So, to date, we still haven't gotten formula there yet. And that's really, I mean, people need formula, and formula is great. And it just doesn't, it can't do that kind of magic. I mean, this is just a biological micro system that we're dealing with. Because it works on the baby's immune system, it actually is protective. And two of the major illnesses that can cause huge expenses, time away from work for the parents who have to bring the baby to the doctor's office, and even in preterm babies can be deadly sometimes. GI infections, necrotizing enterocolitis is one that's, really affects new preterm infants. And that can be deadly. But GI illnesses in general, and it has to do with that population of like giving your baby immunity in the gut. It comes straight from the milk. And then ear infections also are decreased with breastfeeding versus formula. There are plenty of other illnesses. If you think about it, many babies cannot get vaccines. So we do see passive immunity from vaccinating our moms when they're pregnant. They can pass it along that way, but you can also get passive immunity from breast milk. So if mom has an illness, a lot of times she breastfeeds, you can even sometimes see the change in color if you pump the milk. It looks different. And so these nutrients, these immunoglobulins, these things that protect baby are passed directly in their food when there are illnesses around. But the other thing is maternal benefits. There are plenty of maternal benefits that don't get talked about a lot. And if you think about the number one killer of women, it is very relevant, actually. So long-term breastfeeding has been directly related to decreasing risks of illnesses that have to do with your metabolism, like development of diabetes type 2 and coronary artery disease, which is the number one killer of women. So it protects your health, but also it actually decreases your cancer risk. So breast cancer rates go down, ovarian cancer rates go down, uterine cancer rates go down. And then overall health, because of all these long-term benefits, actually affects your, ability to fight off illnesses many years to come. So when you add all the infant parameters and the maternal parameters together, you see a societal effect. You see more people able to stay healthy and in the workforce. You have healthier babies, healthier moms, healthier society, and actually decrease costs because you don't have as much waste from using formula. You don't have, as much production, carbon emissions, these types of things, because you're making it yourself. Across the world, the guidelines are pretty uniform as far as public health initiatives go. We recommend that the most benefit from breastfeeding really comes from 6 months of exclusive breastfeeding. What I mean by that is that this is giving your baby only human milk. And the studies have been done on your own human milk, but we do, because of all the immunologic factors, this may be relevant in donor milk as well. But that aside, 6 months means no formula, no water, no other foods. And that is just what has been studied to show all these increase in benefits and health protection. After 6 months, breastfeeding is actually supported and recommended for 2 years and beyond. And that's a recent change too, actually. The US used to say 1 year and beyond is fine. The American Academy of Pediatrics just released a statement a few years ago saying that 2 years and beyond is supported because that's more in line with global recommendations as well, but also helps to normalize the fact that breastfeeding is very natural past the age of 2, and actually the natural age of weaning, if the little monkeys were left up to their own devices, would be 3 years. And so there have been monumental changes in societal views of lactation and breastfeeding into the toddler years, but the pediatrics, getting behind that really has helped normalize this experience and normalize that people want to feed their babies with their own milk for longer periods of time for all these benefits. They have been around, gosh, for decades, and they usually have chapters all over the place. And so they are ripe with resources, videos, all the things online, but also in person. One of my favorite resources, I'm not sure it's still being updated, but kellymom.com. It is wonderful, especially if you have childcare. And, I find that one of the struggles with people going back to work and trying to feed with their own milk is that the childcare does not understand how breast milk works. And so that can be a source of confusion, but they have printouts and things you can give to your daycare or your caregivers to help them understand the supply and demand and the importance of not overfeeding your baby or throwing out the milk or things that they would normally do with formula. Um, and then firstdroplet.com. This is an amazing resource built by pediatricians and OBGYNs and other breastfeeding medicine specialists. Free resource. They have videos, and they actually have, right when you get on their website, you can look at, did you have a preterm infant or a full-term infant? Because the guidelines are different. The experiences are very different. When your baby can't even eat yet, for example, and now you're pumping, but you don't get the signals from the baby. How do you navigate that? How do you wean the baby off of formula if you'd like to exclusively breastfeed? Or how do you do both? And then on the term side, the full-term side, they tell you all these things that I told you about latch, but hand expression, that one took me 3 kids to figure out, and I'm a breastfeeding medicine doctor. Like, it is not natural. So, you know, watching videos can be immensely helpful. And I would say also Facebook. I mean, maybe I'm showing my age. I'm sure there are TikToks out there too. I just don't know the really reliable resources. But Instagram, one of the ones I liked is called the Balanced Boob. I don't know them personally, but I see some of their posts and they seem really good. But on Facebook, there are lots of groups. If you're looking for donor milk, there's this great organization that is, in different states, different chapters, but it's called Human Milk for Human Babies. So if you need local support, if you're looking for donor milk, that's a good way to do it. It's completely donation based, not, pay for milk. And then, I have found local mom groups to be really supportive. There are huge, huge national breastfeeding Facebook groups, and oftentimes you don't even need to post. You just scroll through, ask, look, do the search button, ask your question. You can find hundreds of posts from people who have been in your shoes, where you can learn on your own. And it's great for like 3 a.m. when you're up and you're struggling and you don't know what's going on and there's nobody to ask and it's very lonely. Those online resources can be amazing. All of this being said, and it's all very nice. As I told you, I almost quit my job over breastfeeding. So I think one of the pieces that really gets glossed over is the emotional aspect of this journey. It can be incredibly taxing and isolating. And there's a lot of judgment, fear of judgment. I always say it's this pervasive, shame inducing experience that nobody talks about because it's supposed to be easy and natural. And obviously, it's the best thing for your baby. So why are you not doing it? Why aren't you working harder to do this? So I had all those demons talking to me as well and telling me I was not enough. And I think, for a lot of parents and moms who have been through this, I found that the next baby is kind of their healing experience. That's when they're really taking ownership, trying to do things differently and trying to build out a better support network because they know better and they're motivated in a different way. And so when I was in those shoes, with my now 11-year-old, I sought the help of a lactation consultant that I worked with at the hospital. And I'll never forget, I asked her, I'm like, okay, I need advice because I was paycheck to paycheck. I was really struggling, crying over spilled milk like you do. Like, just, I was a mess. And she said, well, Andrea, no wonder you weren't sleeping at all. You were a resident. You would spend the one night off of a month staying up all night power pumping to get like half an ounce, and it didn't work. And she's like, you know why it didn't work? Because you were exhausted and you didn't rest. And she's like, your body needs to recover. And that really changed my view. It let me forgive myself for not being superhuman and not being able to stay up all hours of the night pumping to increase my milk supply, which actually didn't do anything. And it really validated the feeling of like, I need rest. And I think that's actually, wearing my OBGYN hat, where a lot of physicians have pushed back on the baby friendly initiative, actually, because those of us who care for the people who have been through 3-day long labors followed by magnesium and a C-section and all these complications, and now they're supposed to like magically make all this milk too. Like, it's a lot to ask. And I think it's short-sighted to expect that everybody recovers the same way and everybody's just going to be like, flower mama, making oodles of milk right after they've been through this marathon and maybe had a stat C-section. Like, there's trauma. Birth trauma is a thing. There is bleeding and bleeding nipples and pain and, things you have never experienced. And it is like drinking out of a fire hydrant right after you have a baby. And then you throw on lack of sleep because now you're up all night. And, I had this fear of like, this baby is going to die on my watch. Like, I could not even sleep when I wanted to because I was watching her and waiting on her to stop breathing all the time. And I know I'm not alone. I know a lot of people like lay in bed and they finally get to rest and they can't rest. And every little sound wakes you up. And that is actually normal. Your body is supposed to attune to the baby, but it does make restful sleep very difficult. And so what do you do? Like, what do you do when you need rest? And maybe you're not going to get 12 hours, but like anything more than like 2 or 3 would be really nice and actually would benefit you. So how do you do that? There's a lot of focus right now on physiologic breastfeeding and physiologic sleep. And, I think there is this myth maybe out there that sleep training is going to be the answer. And when it comes to breastfeeding and chest feeding, sleep training actually kind of goes against this whole how do you maintain a milk supply? How do you build a milk supply? I don't have a problem with people sleep training. You do whatever works for you, and only you know what's best for you and your family. So do what feels right for you. If that doesn't feel right to you, and if you understand that your body's going to need to produce milk throughout the night with a newborn infant who wakes up and needs to eat, and you want it to come from your body, then sleep training is not going to help you. It's actually going to make things worse. Your milk supply is going to drop because you're missing that signal. And you might feel worse about yourself if that was your goal. So, I think, what I would recommend is ask if you have help, if you have access to help, honestly, like one night of like 6 hours, that would hold me over for like a week, honestly. I mean, so, with my fourth baby, it took me 4 babies to do this. With my fourth baby, I had a night nurse come over, and I understand that this comes with some privilege. Not everybody has this, but even your partner, like, I think getting some distance from the baby to sleep and to know that you don't have to worry for a block of time. Maybe it's just 4 hours, but to not hear that crying and have that interrupt your sleep can be very healing for moods, for your motivation to keep going, for your resilience. Like, rest is so important and actually may improve your ability to eat and nourish yourself and, have a good milk supply. And then, if you need to nap and your moods are bothering you, it's okay. It's okay to feed your baby with some other source of food. If you want to maintain your milk supply, just make sure you express that milk to make up for it sometime within those 24 hours. And that for me was a game changer with my second baby. She got formula right in the delivery room because she was preterm and hypoglycemic, but that was her only bottle of formula, which was very different from my first child. And I think it's because I forgave myself. I let myself, I listened to my body. I trusted that I knew what I needed. I had a great mentor tell me it was normal to need rest after I had a baby. I mean, I had no idea. And, once I allowed myself to do what I needed to do, I was able to mentally reset. I was able to recover and then catch up. And I think the problem with catching up is a lot of people don't know how to catch up. And that's really where your lactation specialists come in. And they're companies like the Nest Collaborative, who, is one of Lybbie's partners, but they're a virtual lactation consulting company. Like, you don't even have to leave your house. Like, they can make a same day appointment. And the beauty of, a company like that with virtual care setup is their mission is really to take care of the insurance piece for you. So you don't even have to worry about the financial piece, which is a whole other barrier to getting good lactation care. So all of this to say, you do you, boo boo. You know you best. You know you best. You know your family's needs best. And however you choose to feed your baby, my goal for you as a breastfeeding medicine specialist is that you make an informed decision so you don't feel like you just defaulted to whatever you were stuck with, that you knew and you had the resources that you deserve to have to be able to be successful at however you want to feed your baby.